I think that's such a good question. There are misconceptions about psychology and psychologists. And I think the misconception about psychology, I think, is that there's this stigma to it. It means mental illness. The psychology is sort of synonymous with crazy, there's something wrong in my head, and people don't want to even think about that. People don't want to think about psychology or psychological treatment, and then that comes to the misconception about the psychologist. What's it mean if you see a psychologist, then that means that, oh, you're definitely crazy. That seems to be the biggest misconception I see from everybody, and that creates a reluctance in people to seek treatment. People may see psychologists as this blank slate that Freud initiated for good reason. It had a good intention, and way back in early analytic times when Freud was the founder of psychoanalysis, he said that the therapist needed to be this blank slate so that the client can project any feelings or thoughts onto the therapist, and that therapist or psychologist is simply to interpret, and that's the function of the psychologist. So I think people began to see psychologists as maybe a little robotic, having no feelings, and that's not true. Some people might think we are the epitome of health, which I wish that we were, but we're human, so we struggle with the same things that the general population struggles with. And we are real people. And when you're in therapy, you're in a real relationship. And another misconception is that we only care because we are paid to care. That isn't true. I care deeply about my patients, whether or not they paid me. I would care about them. And that relationship's important to the therapist as well as to the client. And that's a real relationship.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.